The broadcast is now starting. All attendees are in listen-only mode.
Hello and good afternoon, everyone. Welcome to our 2017 webinar series. This is Rebecca Norden, Director of Events and Webmaster for the Medical Fitness Association. Thank you for attending today's educational webinar titled The Hows and Whys of MFA Facility Certification, presented by Bob Boone and Deb Briggs. Bob Boone is President and CEO of the Medical Fitness Association. As a pioneer in the wellness and fitness industry, he brings a wealth of experience, including over 25 years. Bob is a charter member of MFA and has served the association on its first board of directors as secretary and treasurer and moved on to become board chairman. He has authored and co-authored white papers, facility certification standards and guideline chapters, and numerous articles on medically based fitness centers. He is also a frequent presenter at regional and national conferences on topics ranging from the medical fitness difference to integration of medical fitness centers into the continuum of care and healthcare systems or wellness in a sick care world. Deb Briggs received her Bachelor of Science degree in Health, Physical Education, and Recreation from Loyola University of New Orleans and Masters of Education at Ohio University. She has served in the fitness and health environment for 35 years in multiple capacities. Deb has been employed with TriHealth for 26 years, involved in corporate fitness initially, and in 1992 became the project manager for the startup of the TriHealth Fitness and Health Pavilion. She has served as general manager of the TriHealth Pavilion and the Integrative Health and Medicine Center for the past 20 years. She is an MFA fellow, has served on the board of directors for 6 years, and has hosted an MFA regional conference. She also participates on the certification committee and is a facility certification examiner. Before I turn this over, please note a copy of today's presentation in your handout section of the toolbar. You may type in your questions at any time throughout the seminar, and all questions will be answered at the end. Bob and Deb, take it away.
Thank you, Rebecca. One more thing you didn't say about Deb, I think it's important to note. Deb at TriHealth was the very first facility that went through the facility certification process. And I believe, Deb, if I'm not correct, that your facility was also the first facility to go through a recertification with 100% of the standards met. So you're in rare company today, and I hope that you'll ask Deb some really great questions as we go along. So we have a lot of material to cover today, so we're going to be flying through these slides. We have about 90 slides to cover in an hour. So we're going to fly through them pretty quickly. So if you do have questions going along, please be sure to type them in the question box, and we'll try to leave a little time at the end. So if my slide will work, there we go. Today we're going to talk about why you should consider becoming a certified MFA facility, a little bit about how to prepare. We're going to briefly overview the standards and guidelines, hit some high points. We can't go through all 209 standards. And we hope that you'll take a chance to learn from Deb and I. We both are examiners, and even though I don't do too many anymore in my new role. But also we have lots of tools and ideas for you as we go along. So first, why should you become certified? Well, several reasons. One, it becomes a good housekeeping seal of approval for your health system, for your physicians, for other practitioners that says, hey, we're different. We have held ourselves out to a higher standard than the rest of the community, and we have people who are trained and ready to handle your chronic disease patients that you might want to send to us docs. So it's a good way to build rapport and physician referral networks. We position yourself, or you'll position yourself as a provider of choice in your community for what you have, and you can emphasize that through your marketing materials to really differentiate yourself from the local, other local providers. Your hospital is particularly concerned these days with population health management, with readmissions to their hospital, disease management initiatives, and a whole plethora of risk-based interventions that they are trying to figure out how to do with their patients in order to minimize the impact on them from readmissions and other shared risk concerns that they have. So if you position yourself properly and talk to your administration, you can position yourself as a tool in their toolbox for dealing with population health management and value-based care as a community-based initiative. So going through the process, I'll let Deb talk about this some when she gets on, is that it really does improve the camaraderie, the cooperation, the collaboration among the staff, and it really helps a lot in terms of improving the operation of your facility, just making sure that there is a unified process in place. It forces you to start looking at data and using it in a meaningful way, and it helps you discipline yourself to look at outcomes, which are incredibly important going forward. So again, there's other ways that you can use the data, including improving your membership sales. So first off, what do? You need to, if you haven't already got one and you're interested in this process, please obtain a copy of the Standards and Guidelines. It's the 2nd edition currently. We're working on the 3rd edition now. It's available on our website. Just visit our site and go to the store. There is in the back of that book as an appendix a facility self-study guide, which is basically an Excel spreadsheet similar to the one that the examiners will look at if they come on site. Collect your documentation. Most of the documentation requires a year's worth of documentation, and when you're ready, the application is online with details about how to do that. Quickly, the initial certification is currently $7,500. It's broken up into 3 payments, and if you have additional facilities, more than one facility, there's a discount. So you can see the numbers. I don't need to read them. So basically, we break it up into 3 sections. The first one is your application. When we receive it, we will review it on site, and when we're satisfied that all the phase 1 documentation is complete, we'll move on to phase 2, request a little bit of additional documentation, and let you begin working on your proposed agenda, begin to look at potential site visit dates. Once we've got that completed, you'll also have to do your site, your self-study checklist at that point. Once we've reviewed that information and resolved any questions, we'll schedule the site visit examination, and upon your payment, we'll confirm that site visit date. And so from start to finish in the application process, typically 2 to 3 months from the time you apply to the time we can get someone on site. So once your site evaluation is done, the examiners will complete their work and turn their forms in back to the office, whereupon we review it, resolve any issues we see. We forward it to the certification committee. They will review it thoroughly and make a recommendation, and then we'll send it to the board of directors for their review and eventual approval. That process can take as long as 6 weeks, but more likely we can get it done in 2 to 3 weeks after your site visit if there are no issues that need to be dealt with. So if you want to do this, if you want to become a certified, what's the basic requirements? One, you have to be a member, you have to be a facility member of the MFA, and you have to have been open and operational for a year. You have to meet a whole bunch of pass-fail requirements. We'll go over those in a few minutes, primarily around medical oversight. We're going to talk about pre-activity screening. We'll talk about emergency response plans and a number of other things that are involved in the pass-fail requirements, but we'll get to those when we get to the standards here in a few minutes. Here's a few more. You got to have at least 3 clinically based programs. We talk a lot about staffing, and we talk a lot about quality management. I want to take just a second when we're talking about quality and outcomes to tell you one quick side story. The early part of this week I spent in Washington, D.C. at the National Academy of Sciences at a symposium they were having on cancer wellness. And as the days went on in that program, what the physicians and other practitioners who were there were describing that they wanted to see developed was exactly what we offer in medical fitness. They were looking for a structured and outcomes-based exercise and physical activity, nutrition, lifestyle management program for their patients, not only during the time of their treatment, but also in the survivorship mode, so in the longer-term aspect. So it was encouraging to hear that what they wanted is what we have developed. It was discouraging to know that none of them have ever heard of us. But every one of them, as we began to have conversations over the days, said, show us your data. Show us the ability, that you have the ability to do this, and we'll flood you with business. So it emphasizes the importance to me of getting involved in outcomes, of getting involved in all kinds of studies that we have access to be able to gather the data to show that what we're doing is cost effective and clinically effective. So moving right along. You must recertify every 3 years. Your initial evaluation is done by 2 examiners. On reevaluation, depending on your size, it may either be 1 or 2 examiners. We will look to see for the areas that you were not in compliance with or areas that there were recommendations, whether you've shown any improvement. You must continue to meet all pass-fail guidelines. This is just a sample of the 2-day visit schedule. I want to emphasize, because there's been a little bit of confusion about this lately, we will send you a sample agenda much like this during the process. But understand it is your survey, and so if you need the items that are listed on the sample agenda are the meetings that need to occur, but they do not have to occur in this order. It can easily be swapped around. Pretty much any meeting can be swapped around to meet the needs of your staff and leadership. So again, it's your process, and the examiners are pretty flexible. So in communication between you and the lead examiner, once he's assigned, y'all can refine the agenda and make it work for your site. Currently, each guideline receives a score of 1 or 0 or not applicable. NA can only be used when the center is unable to comply due to facility design. So for example, if you don't have an aquatics area, guess what? The aquatic standards don't apply to you. Or your policy is greater than the intent of the guidelines, and there's an example of that when we talk about waivers. If your facility doesn't allow a waiver for someone that doesn't want to go through a pre-activity screen, for example, then you could score an NA on the standards related to that waiver policy. If you're outside the U.S., you've got to comply with the intent of the guidelines using local applicable rules. For example, outside the U.S., you're not going to have HIPAA or OSHA or ADA or MSDS per se, but we will look to see that you're following the local applicable local rules that you have. The possible score is the maximum score minus any NAs, and the final score is the total number of ones divided by the possible score. So how does that look? So if there's a possible 209 standards, if we applied 10 NAs, then your revised possible score is 199. You actually scored 185, therefore you had a 92.9%. You have to have a 90% final score plus all pass-fail standards passed to receive a passing score. So that's briefly how the process works. Just a note, we are looking at changing the weighting of some of the standards. That's currently under review. Would probably take place next January if those new changes do become effective. So we will communicate loud and long when that happens so that nobody's going to be caught off guard if you're in the middle of proposing. But we're going to simplify some of the standards because some of them are a little bit duplicative now, and we'll be in the same process changing the weighting on some of the standards. So stay tuned. There's more information coming. They won't be effective until next January. So when you're ready to get started, here's what you need to do. You need to get your team together. We will look to see that everybody on your team is involved. This can't be a 1 or a 2-person activity and have it be successful. So the expectation is that your entire staff is involved. Every standard we would expect to see either in binders or in some kind of a file system, a tabbed system, so that for every standard and every guideline underneath the standard we can easily see your evidence of compliance with the standard. So we hope that you'll be able to do that, and again, if it asks for a year's worth of compliance, we'll expect to see a year's worth of documentation of that compliance. We recommend that you hold regular meetings. Some people do it as often as weekly with your staff. Some people do it every couple of weeks to review the guidelines, make sure people who have received assignments to get stuff together are on task, and that you're ready when the time comes. Here's just some examples of what some binder collections look like. There's been as simple as putting them in cardboard boxes, or as you can see, somebody took up a whole row of shelving for that. So use your choice of preference for doing it. We generally find binders work better. Some people have used tabbed files. You can see here how it works. It doesn't really matter to us. We'll look at it any way you want us to. We are even accepting online as long as you provide us with access and a terminal to get to all the documentation that we might need. Can't emphasize enough, this is a team effort. So MFA examiners, when they come on site, they'll be looking at your policies, they'll be touring around, meeting with your staff, and they're looking for consistency between what they see as written policies and what your staff have implemented. So if your staff are performing one way, your policies should reflect the way your staff is working, and they should know that. So again, part of that is making sure that you have great staff communications, make it a part of your daily conversations as you prepare for your examination, and communicate, communicate, communicate. A lot of facilities created cheat sheets. I won't spend much time here, but these are some of the key things that they were looking at Galter for their initiatives. And we'll get right now into the standards. We'll kind of hit some of the highlights, some of the pass-fail standards. And then Deb will jump in when we get to standard 3. First off, the very first thing is medical oversight. Your center must have medical oversight. So what does that mean? We're looking to see that you have in place either a medical director, a physician's advisory committee, and you must meet with them at least quarterly, so at least 4 times a year. And so in that we look for, well, if we have a physician's advisory committee, which is what we recommend, we look to see that you have a variety of different physician specialties on your committee, and that you are reviewing with them all the programmatic aspects of your facility, all the risk management aspects of your facility, certainly looking over your policies surrounding emergency response and risk management at a minimum. But we also want them looking at your outcomes data. We want them looking at basically every aspect of your facility and giving input for a number of reasons. One, to ensure that what you're doing is consistent with the most recent medical thinking and that it's in line with the goals and the current thinking of your medical staff, so that of your affiliated facility, so that those folks on your physician's advisory committee can indeed be ambassadors for your program to other physicians and providers and referrers in the community. So again, those are that's some of the reasons, but at a minimum, to hold yourself out as a medical fitness facility, you have to be able to demonstrate medical oversight. Here's an example just on the website where they've done little bios of each person on their physician's advisory board as a part of their website to promote it out to the community. This is an example of the meeting. This was actually a 2-day meeting. They had a choice of which day you attend at TriHealth. Deb, you can jump in on that if you want. But you look at the sample agenda, they're talking about their exercise medicine program, their outreach, community outreach, they're talking about cancer wellness, they're talking about weight management, they're talking about risk management, they're talking about community lectures. So again, the whole wide range of issues that get covered. That's primarily the basis of Standard 1. We look at all aspects. There's certainly more standards than what we just mentioned, but those are the key ones in making sure that we have medical oversight. Secondly, now we get to programming. Your programs and services must comply with the current requirements of Medicare and Medicaid if you're in the U.S. What this means, a lot of people get confused by this. This means if you have a program that's billable to CMS, then it must meet CMS's guidelines. So cardiac rehab and physical therapy, pulmonary rehab, those are kind of the primary ones right now. Whether or not they report to you, if they're in your building and they're leasing space from you, then you are required to be able to demonstrate that they meet CMS. Well, how do you do that? Well, there's a couple of ways. Those programs have to be accredited, cardiac rehab by AACVPR or physical therapy by Joint Commission or CARF. So you could show us that they have been accredited. You can show us simply a bill, an EOB that comes back to the hospital or to that program from CMS that says, hey, gosh, if we've successfully billed and been paid by CMS, well, I guess we meet their requirements because they wouldn't pay me otherwise. So it's pretty simple to show, but you must demonstrate that the programs that are under the roof and shared with you and any clinical programs in that way are currently certified by Medicare Medicaid. There's a good reason for this in that a few years ago, and when we started this process, there were some providers out there that were kind of fly-by-night providers that were not providing very good and very consistent services. They were not approved by Medicare and Medicaid, and they were doing some things that were not, I shall say, mainstream. And so from a liability perspective, we decided to put this requirement into our standards to make sure they were meeting the minimum set of standards for billing services and for providing the quality of care management services required by CMS. Okay. The third standard within medical oversight is you've got to demonstrate a direct and valid relationship to your community healthcare system. So if you're a hospital-based center, well, de facto, you're part of the hospital, so that's easy to prove. If you're a commercial center or you're another facility not affiliated with the hospital, you have to demonstrate through referral patterns, through participation in committees. You've got to be able to demonstrate that you have a relationship with the local continuum of care. Some have chosen to do it only through local physicians and referral patterns. Some have done it only through the hospital. We recommend that you try to develop a relationship with both if you're not a part of the local healthcare system, just because there's multiple opportunities for cross-referral. So this is an example of an organizational chart that, for a fitness center. You'll see it under the right there. It says Fitness Connection over there. They're part of the South Jersey healthcare corporate structure. That in and of itself is sufficient documentation to show that you have a relationship with the healthcare system. You're owned by it. You're under a recognized arm of that structure, and so you have access to the leadership of that organization through the organizational structure. We'll look for a mission statement. Not if you're hospital owned, we're not looking for your hospital mission statement. We're looking for one from the fitness center. This happens to be the one from Deb's facility. You see a nice picture of Deb right down there in the front in the white sweater, if you don't know her. So that's an example of a mission statement. Here are examples of community screenings and those kinds of things that we would expect you to see. So moving on to quality management. Quality management, this is probably one of the most misunderstood, and this is one of the standards that we'll be rewriting in the next version. But basically, we want to make sure that the policies and procedures that are written in the facilities concerning your programs and services are consistent with your center mission and with your important goals and objectives. So we will look for that consistency. We will look to see that you're driving the programs that you create based on what you say is important to you through your mission, goals, and objectives. We're also going to look to see, do you have a process in place to measure and report the outcomes of your programs? In other words, how do you know that your activity was successful? And how do you know if you should continue it? How do you know if you should modify it? Or how do you know if you should terminate it? If you're not measuring it, you don't really know. And it's more than just saying, well, we've got a lot of people in this class, so it must be successful. We're looking for a little more detail than that, whether it be member satisfaction, whether it be observational input from other. If it's a Group X program, for example, you could be peer reviewed, if you will. So we're looking for some kind of measure that looks at all of your primary programming over time. You don't have to do it all the time, but we're looking to find that you have a systematic process in place to measure and monitor your key programs. And so in particular, we're looking around pre-activity screening, performance improvement, and your programs and services. You got to act on that data. It doesn't do any good to collect the data if you're not going to act on it and evaluate it. So we look to see how are you using the data that you're collecting. And we're looking specifically around how do you use that for individual members. So if you test someone initially when they join your facility, but you don't ever retest them, how can you say what results they've had? How can you say that they've improved? How do you use the results from a pre-activity screen, for example? Does the exercise physiologist who eventually does the fitness evaluation, does he have access to that pre-activity screen to pick up on any history or risk that might have been reported there? So have we taken into account all the users' health and exercise risk factors in preparing their exercise prescriptions? We're looking to see proof that all that's done. We also will be looking at business performance, so we'll be looking at financial measures as well. A lot of different quality management processes that you can use. We don't care which one you use. You just got to demonstrate that you're using one and show us how it works in your place. So this is a difficult standard for a lot of people, but we are looking now to see if you have a system in place to ensure that every user gets the most effort, the most benefit from their program. And the only way to know that is if you're measuring and monitoring them. So we look to see the orientation piece, the onboarding piece, what you're doing for base exercise testing, your recommendations. We'll be looking at samples of those kinds of things. But we'll be looking to see how are you measuring and monitoring with those individuals to make sure that they're moving along. How do you know when to advance them to the next level in their exercise prescription? And so we don't care how that process looks in your facility. We just care that you have a process and you're able to explain it, define it, and defend it. A lot of people put together quality dashboards. Some of it's financial measures. Some of it's other clinical measures. We look to see how you can do that. We also look to see that you're using benchmarks where they're available to compare to, so you can see how are you comparing to the rest of the industry. Here's just some examples of some benchmark data from IRSA and MFA and 60,000 square foot facilities and the 35 to 60,000 square foot facilities, and the center's numbers are down the middle, so you can do a comparison. The only thing I would suggest to do differently in this is to maybe put a delta column in there that shows the delta between your center and whichever benchmark you choose. Another way to do it, this was from a member survey. You can look and see where improvements are needed and where you can use this as an action plan for working on certain issues. Again, another example of an action plan that was created based on the member survey. Those are assigned to individuals, as you'll see, and so there's an accountability created so that you can hold people accountable to moving forward, making changes, and then remeasuring to see if you were successful. Okay. Gosh, Deb, have I stepped on you already? I guess I did, didn't I?
No, that's just an example of a program. Actually, that was one of our weight management and how we tracked the outcomes and compared it to national data.
Okay, there you go. So you can see what we're looking at here. This doesn't have to be extremely complicated, but it really is an important way to take a look at your results, your quality indicators and outcomes, so that you have data you can use to report back to physicians that say, hey doc, if you refer people to our weight management program, here's what we see and here's how it compares to benchmarks, and this is why you should feel comfortable sending your patients to us. Okay, so Deb, we get to pre-activity screening. That's you.
Very good. Hi everybody. Thanks for joining us today. I'm going to take you through the next 3 standards. And again, we'll probably move through these very quickly, but I know that Bob and Rebecca are always available to help you after we've gone through this practice today. But the 3rd standard is the pre-activity screening. It is a pass-fail, and basically what this means is that every member that joins must be offered a participation screening. But as we all know, this is what differentiates us from commercial clubs. We all provide health history forms, PAR-Qs, and we can use that information to take it to the next step to see if anyone does have multiple risk factors. If they do, we need a physician consent form for those high-risk individuals. We risk stratify them in order to help them build a program that's suitable to their health needs. Bob talked about some NAs. And this is where some people choose to have a waiver if someone is at risk and should not be participating. Some clubs decide not to. So it depends on your policy whether that would be an NA or not on your score sheet. We also want to make sure that you're following HIPAA, privacy compliance when you are sending information to and from physicians throughout their membership, not just the beginning part with health history and physician consent. So what we've done at our club, just to be comfortable with that, is we just make every member fill out a HIPAA form when they join, and we keep it in their file, because you never know when you might want to be sending some outcomes to the physician. But here's some examples of some PARQs and some medical clearance forms that people have used. And again, when you purchase the standards book, there is copies of all these different types of forms. So if anyone online today is maybe just starting up a center and you're like, man, there's a lot of forms, we've got those forms in the books for you to follow and to use. And there's plenty of centers that are willing to help. So here's a copy of a HIPAA form. Next, Bob. And then every member should be assessed, or at least offered an assessment. We have some folks here that don't want to be assessed until they lose weight. We know that that probably happens, but we want to get them on board immediately. So we just want to see that you have various tests available, and that you're also offering folks opportunities, and you're promoting and marketing the opportunity to be tested every 6 months or every year, but we need to see proof of that. Okay, Bob. I'm hopping on now to standard number 4, and this is risk management and emergency responses. This is a pass-fail. Your center must have some type of emergency plan, a binder, a list of how we are going to respond in the case of all types of emergencies. Some may vary on the part of country where you live, whether you deal with hurricanes or tornadoes or earthquakes, but it has to be a written plan with the various forms. We like to see your drills. We think it's really smart that you do some mock drills all the time so that your staff is ready when the examiners come. More than likely, the examiners are going to walk up to one of your staff and give them a mock situation and ask them how they can respond. And it's important that every one of your team members respond to the same kind of drill in the same manner, so there has to be consistency. All these drills and emergency procedures needs to be reviewed and approved by your medical directory. We'll look at first aid kits to make sure that there's appropriate contents that are in there and that the contents have not expired and that they're being checked periodically. We'll look at how you report incidents that happen. We'll look at your signage. Are we easily able to see where the AED is hung? Are there an adequate number of AEDs? And by adequate number, we mean that your staff needs to freely reach an AED within a 1.5-minute walk or fast walk. So you might want to play with that a little bit and see if you need additional AEDs in your center. We'll also look to make sure that all of your team members are certified and trained in AED and CPR. We will need to see how you track that. A lot of us these days, the hospitals assist us, but we just need forms that show that all of your team members are certified. Then there is some new verbiage there, and we look for all team members that have direct contact with your members and your guest. So example, the night cleaning crew that's there when the building is closed, no, they don't have to show CPR. The plumbers that come in don't have to, but you know, if you've got housekeepers that are floating through your locker rooms and distributing towels or filling product and they're in direct contact with your members and guests, then they must be CPR certified. Next, Bob. Again, here's just some nice examples of different types of procedures that different facilities have. Next. And again, great signage for the AED and logging so that we can see how often the machines are being checked to make sure that your battery doesn't die. Next.
Before you go to that, I want to add one comment real quickly, Deb, because we see this a lot. If you look at that sign-off sheet that's currently on your screen, you'll see that it's done by date, it's done appropriately, you'll see the initials there, but we have no way of knowing who those initials are. So if you're going to do this kind of a sheet, we ask you to extend the sheet a little bit and have a place for everybody to print and put their initials down so that you can hold it, go back to an individual if you ever need to figure out who they are. So you have them sign their initials and print their names so you can figure out who they are.
Okay, great. Eye wash stations, again, make sure that your team members know how to use them. I know that they probably don't get used very frequently, but these do need to be checked, and make sure everybody knows how to use them. And additional signage for emergency telephones. And again, you want to see standard ANSI signage being used around the center. So your perceived exertion charts. Some folks only have them posted like in your Group X studios, but anywhere that there's someone doing exertion, you know, in your free weight areas, so all of your areas need to have the perceived exertion signage. And appropriate out of order, make sure that all of your out of order signs are the same throughout the center. Okay, next. Again, some examples of some different signage. Next. Your occupancy signs need to be up, and that is something that the fire department determines when your facility is built, but you just might want to check that. Again, okay, Bob? Appropriate signs, if you use the different code blues and just general information, just make sure that all your doors are signed. Again, more nice examples that we've seen. Next. There are some requirements for steam, sauna, whirlpool, as well as different signage in your aquatic areas that are required, and all of those are on your checklist when you get those. Next, Bob. Again, here's required signage for your pools. Next. Sign everywhere, sign. You see them, but it is important. You'll want your MSDS sheets to be out as well. Next. Okay, our next standard is standard number 5, and this is on programs and services. This too is a pass-fail. Bob talked a lot about disease management programs. Well, this standard requires us to have a minimum of 3 clinical or fitness programs and services that address medical conditions. So, for example, if you've got a weight management class, that might be 1. I have a cancer wellness class, that might be 2. I have a balance class, that might be 3. So, you know, you pick 3 of your disease management types of programs that it can address different issues, and then we're going to track outcomes on that. But we also want to see some nutrition, we want to see some mental health. But with the main 3 programs that you choose, you want to make sure that you're getting information to and from a referring physician for some of the clients that are in your program. You have to be really careful on the HIPAA, because more than likely in these programs you are collecting a lot of medical information. So one helpful hint also is when you put together your binders, make sure that the information you have in your binders, that you white out these clients' names on all of those sheets. Sometimes we forget to do that, and that would not be good. So we want to see programs for your community. Again, that's what we as medical fitness centers promote in our mission, is that we provide things that are open to the community. So we'll want to see examples of that. So in your programs, you're going to want to show us your attendance. Like Bob mentioned, the evaluations. What did the people learn? Some letters to and from physicians, your outcomes, a needs assessment, the whole gamut of putting a full program together. Okay, next Bob. These are some examples of some great programs that are more maybe like a step-down program or a post-rehab program that people have used that are just excellent. Next. Some folks go through and use your referrals from your electronic medical record. I know that we've got access here at our fitness center, so that's something that if you don't have, you might want to look into. Can physicians refer a client to you immediately through an EMR email that you can pull up and get various information? Next. Again, we'll want to see the sheets filled out except for the client's name at the top, but we'll want to see some real people, real examples of what you're doing out there. Next. And then the follow-up to the physician, it can be very simple, but we've got examples of some letters for you. Next, Bob. And again, the HIPAA form. Next. And Bob, you're up. One thing I did want to quickly mention is, you know, if some of this type of thing is new to you, this is where if you come to the regional and the national conferences that you're going to learn about a lot of these clinical programs and, again, what some of the centers do to become certified.
Okay. Thank you, Deb. Move on to the next standard. Are we going fast enough for y'all? I know we're flying. The Children and Youth Standards was new to our second edition, so they've been around since 2013. And some of them on first blush appear real repetitive, and we're rewording some of them, but they're really not. Just if you look at the standards, the first set of standards is all about, do you have certain things included in your policies, and the second part is, are those things available to the parents in clear and understandable ways. So what appears to be duplicative in them, it really is not. But we'll look at holding your child care programs, even drop-off child care, if you have them for only a couple hours a day, to a higher standard. These are based on more on most states' child care standards for daycare. But we don't believe they're too onerous. We think that you ought to, basically you ought to know if kids that come and stay with you, whether or not they have any risks that you need to know about, whether they have any allergies, if you have food being served in your area. You ought to know who the child is, who's able to pick them up. So if mom drops them off, can dad pick them up, or does mom have to pick them up if she dropped them off? Because you never know what you could run into, that situation where there might be a protective order and one parent's not allowed to pick up the child because it's in the custody of another parent. Or is grandma able to pick them up? And how, who do you have in terms of an emergency contact? So mom drops child off and then she has an accident in the building and she's transported to the emergency room. Well, who do you contact to come pick up the child? Those kind of things. These are all risk-based standards, and so I'm not going to go over them in detail, but you'll see that all these children's standards are based around risks to your facility for having children in your facility. They also apply more in depth as we come to programs and services that you have within your facility. So if you're doing camps, if you're doing children's strength training programs, or you're doing sports-related programs, we want to make sure that any staff you have working with these folks have the appropriate training and qualifications, that background checks are done, they have children and youth, infant and youth CPR standards in place, all those kinds of things. So again, without going into a lot of detail, there's 40 some odd guidelines among the children and youth standards. So we look to see basically, have you done everything you can in your power to make sure the kids in your care are going to be safe? Here's this third one. This is where we kind of repeat what was in the first standard, but are these things available in a handbook or some kind of mechanism to give out to parents so they know what's expected of them and they know what's expected of you. So there's a clear way. Do you have a program where your bus drops off kids at your place after school for an hour or so before parents pick them up? So if so, there's those kind of guidelines in place. Secondly, do you ever run activities outside of your building? So do you have an outdoor basketball court, or do you take them out for a walking trail out around your facility? If you do, what do you have in place from a risk management and from an emergency response system when everybody's outdoors? And have you thought about that, and do you have it in place? So those are the kind of things that we're going to look for. You're basically going to tell us what programs and services you offer and how they align with these standards. So again, here's more of the information that just makes sure parents know what's expected of them. Again, I guess I'm not going to read all of these things. You'll be able to read through those in the standards in the standards book as you get them. If you are doing programs, if you are doing like coaching programs or sport-specific programs, do you have daily lesson plans that you're trying to meet, and how do you know that you've met those things? So we'll be looking to see, do you have metrics in place for that as well. This is an example from Deb's Place. They offer all kinds of sports camps and summer activities for kids, as you can see. So it talks about how do you register, how do you, how do you do all these, how do you get involved, and how, what's the size, and just tries to give a lot of information to parents so they know how to best prepare. Do you have in place an infant and child abduction emergency policy? It has been known to happen. Do you just follow Amber Alert? Do you follow your hospital's policy if you're hospital-based? How do you lock down your facility? Are staff trained in those kind of things so they know how to lock down the facility if you need to, if you find that a child is missing? I'm not going to go through this. An example of gym rules, safety and security. These are posted on the walls and available for parents. So again, I'm not going to spend much time on those. We'll move on to the aquatic standards. Obviously, if you don't have a pool in your facility, then the aquatic standards will all be NA. Same thing if you don't have any child care activities, you don't have any drop-off child care, you're an adult-only facility, none of those children and youth standards would apply to you. But if you do have aquatics, then there are quite a number of rules that we look to make sure that the operation you have is risk-based and safe. So basically, in each area, we look to see, do your staff have the appropriate training? Are you running appropriate emergency drills? Are there competencies documented that might be separate than other competencies that are required? How do you handle MSDS in your pool chemical room or even on your pool deck with exposure to certain chemicals? Do you have an eye wash station in or near that's easily findable in your in or near your pool chemical room? Do you have in place your fecal matter or other body fluid policies, and are you Virginia Grain Baker compliant with your drainage systems? Do you have access to a CPO? Those kind of things. These are samples of how people manage their MSDS. We get asked these questions a lot. We've gone to an online MSDS system. Is that sufficient? And I say what our answer to that is, it's up to you to demonstrate to us how if somebody splashes chlorine in their eye that someone can easily access information about how to treat that if they don't know, and it's got to be readily accessible to where that is. Now, I don't know about you, but I'm not sure I want to put a computer in my pool chemical room because the chemicals in the air will eat your computer up in about 6 months. So, do you have one that's in a drop-down box right outside the pool area or right outside the pool chemical area that may be accessible, that might work? If that's how you do it, that's great. We suggest, however, that each area have access to MSDS information that's related to the hazards that are found in that area. So if you're in the pool chemical room, your MSDS sheets doesn't need to have stuff on housekeeping chemicals unless that's where you store them. It needs to be specific to the area where you are, and that makes it easier to find the hazards that you're dealing with if you ever need to access that information in an emergency. Do you have appropriate warning signs that talk about all the applicable rules and regulations that are required by your state around pools, saunas, and whirlpools? Again, the main thing we're going to look for, every state's a little bit different in what they require for aquatics. So it's up to each facility to show us what the state standards are and to show us how you're in compliance with them. Moving on to staffing. Again, this is a pass-fail requirement, so what we look at are staff qualifications in a number of different areas. So we look at everything from management down to your Group X, your personal trainers, your clinical programming staff, your nutritionists and nurses, and as well as just your floor staff. So it's important to note that at least one person in each key program area must meet all the appropriate qualifications, and that they are in the chain of command for everyone else below them that may not have all of those particular requirements. So, for example, for most areas, we ask that people have either a BA, BS, or a master's degree in an exercise-related field, this is not pass-fail for Group X or Aquatics directors, but for the other fields that it is. We ask that any certifications that they have be NCCA, ANSI, or ISO 17024 accredited. Those are the only ones that MFA recognizes, so you can, if you're unsure about that, you can go to the NCCA website and look up that specific list of which certifications are accredited. If they have licensure, we need to verify that, we need to look to see that all licenses are verified. AED CPR, you heard Deb say a while ago, we'll look to see that, that current training is in place, and it's up to you to demonstrate to us that all staff have met the AED CPR training and that it is current. There needs to be a documented process. You'll show that to us how you do it in your facility. Also, you'll show us how you maintain competency throughout the year. So if you're only, if you, for example, have CPR from American Heart and you don't do it again for 2 years, I'm not sure I want you doing CPR on me if you haven't practiced in 2 years. So we look to see, do you have ongoing training and practice opportunities for your staff so that you can be assured they're maintaining their competency. This can be done as part of the routine drills that you do. It can be done as part of in-services. It can be done in a number of different ways. But we look to see that you're demonstrating to us that your staff have the opportunity to practice that ongoing training should it be needed. We look to see that you're providing ongoing training and education opportunities for your staff members. Certainly one of the reasons for requiring you to be a facility member of MFA is access to all the webinar training that we do, such as you're getting today. So we do about 26 webinars a year that are available where continuing education credits available for free to the members of MFA. So that means your staff. Do they have a chance to ever go to seminars, conferences, site visits, facility workshops, whatever else we might? We want to just see that you're providing opportunities for your staff to continue their training. This is a sample that someone did for us a few years ago, where they listed on the left there each job title, who currently is the resident of that particular position, multiple facilities, and what their what's required for their job and how current that it is. How current is universal precautions or CPR or diabetic training or whatever it might be listed out. So just an easy way to track, and that's a good way for us for you to show us that your staff is in compliance with all these different requirements. Some people do it online. They have online learning logs, and so with that, for example, you could demonstrate to us by showing us this kind of a page on your computer that here's our annual competency training that our hospital requires. So we'll see all the topics that are covered. All you'd need to show us is a list then of your employee log that says all of them have gone through the annual training, and then we can pass off on that particular standard. So I'm going to give it back to Deb to go over the last standard. We're doing okay on time, so we'll flip through the rest of these, and then we'll try to leave a few minutes for questions at the end. So, Deb?
Okay, last standard, number 9, facility operations. Next, Bob. This standard talks about check-ins and waivers. So again, I know most of us have some type of an electronic check-in station, but are we monitoring who comes into the center? Do you have guest waivers that you have people fill out? Are there check-in sheets? Maybe you're tracking who's taking a Group X class or things like that. So we just want to make sure that we're monitoring who's in the club and making sure that they're all appropriately screened. So also on your guest registration waiver form, do you have information at the bottom about any risk that they may be taking or that they are disclosing to you or visiting their physician if they have any risk factors? So it's very easy to capture on that waiver. Some things that we'll see, and a lot of this we'll note as examiners as we're walking around the building. Documenting airflow is a little bit difficult, but we'll notice it if we're walking through the center and there's lots of humidity, and the minute you walk in the door you smell, a lot of chlorine, or the windows are all foggy. Then we might ask you, how do you monitor the airflow? Who's checking it, and is it all appropriate? lighting, make sure in some of your dark corners around tracks, and when we get there that all of your lights are lit, and we'll look to make sure that there's handicap accessibility, even starting at your front door. I know a lot of our centers might be rather old, and you want to make sure that your folks can get in and around and use all of the facilities. So we ask you annually to have a couple people go through your center that are handicapped, maybe one's in a wheelchair and one's in a walker, and fill out a survey to say that they're able to easily assess all areas of your center. Can they get a shower? Can they get in the pool? Can they get a good workout in? So that is a requirement. Do you have training for special POPs? Most of these centers do have deconditioned members, so we want to make sure that your staff are trained to handle all types of folks that come in that want to use our centers. Do we have preventive maintenance plans on the facility and especially on your exercise equipment? Who's in charge of tracking your equipment, the repairs, how often it's been done, what does the manufacturer require for monthly or quarterly or annual maintenance, and where is it tracked? So we'll want to see those logs. Check your storage rooms. I'm a big storage closet person, so I open every door in all the centers. I want to make sure that there aren't boxes on the floor or boxes too close to the ceiling that might be covering up one of your sprinkler heads, or are there chemicals that aren't marked? So you need to go through your storage areas and make sure that they're neat and clean and organized. Again, we talked a little bit about this signage earlier. And again, making sure that your staff are trained on handling bodily fluids and contamination. We might pick up a bottle as we're going through the center and just ask one of your team members to show us the MSDS sheets, and then talk to them about if there was a chemical spill or a vomit, how would they go about cleaning it up. So we just want to make sure that they know what is in the written policies, not just that you have a written policy, but that folks are trained on it. Okay, Bob. Next.
I'm working on it. It's not going all of a sudden. There it goes. Sorry.
Okay. So again, basically is this kind of a wrap-up is what can you do with your certification once you get it? Besides, a nice little party with your staff, there's lots of things that we need to do to market it. The MFA office has a full packet of information that they'll send to you, some decals, they'll send a PSA announcement that you can use, you'll have your logo, you'll have their nice certificate that is nicely framed that you can hang. But then you can use the fact that you're a certified medical fitness center on your letterhead, on your website. You can make a banner. I'd have a party. I'd get an announcement out to your members. And you'll be surprised how many folks that you have that are members that go through this type of certification in their own professions, such as nurses and blue ribbon schools. And you can let them know that this is just like that you went through a lot of work to really prove to them that you run a very sound, quality, and safe environment. Next, Bob. So this is a banner that we hung, and we put it across our entrance. Next. And then a couple of the centers, hung their decals. And then more banners that you saw earlier. And then how can you actually educate everyone on your web page, including the entire hospital staff, to know what is the medical fitness difference and that you won that seal of approval. It's just as big as getting approved by Joint Commission and maybe some magnet awards, so you really need to build it up in your hospital. Next, Bob. Again, more examples of some of the great centers that have achieved this certification. Next. A lot of people made t-shirts for their team members to wear to really show it off. Next. Everybody has parties. You'll realize how important the party is after everybody together has worked so hard on this project. Next. Again, some open houses, some celebration weeks, and try to make a goal to gain some new members from your marketing. And it does work. Next.
That's it.
Yeah, we want to thank some of the different centers around the country that helped us put together this PowerPoint today. And here's just some names of the people that have participated throughout probably the last 7-9 years of making sure that you guys have the information that you need.
Yep. So now it's your turn. It's 3 o'clock, so we don't have much time, but if you have any questions, now's the time, please, to type them into your question and answer box at the bottom. I would also tell you that if you decide to pursue certification, I am your first line of defense, so call here at the office. I've been involved from the very beginning of this process. We actually first proposed doing the facility certification and standards when I was chairman of the board back in 2001. And it took us until 2009 to get the program up and running. So I did help rewrite some of the standards. I am an examiner from the beginning, and so I now serve primarily in a consulting role to members who are seeking certification, and then other examiners who are out working in the field are the primary ones who do the site visits. I gave you just one more minute to see if anybody's got any questions. Right now, nobody has questions, so that must mean we did a great job, Deb. I would just say if you do have questions, so we will go ahead and wrap this up. If you do have questions, please feel free to write me here in the office. My email is simple. It's bob.boone@medicalfitness.org. And so, like I said, I'm the first line of questioning for you about any of the standards that you might have or any issues you have around certification.
I'll be at the Central Region Conference. If anyone from Central Region is on the call today, I'm happy to answer any questions.
That sounds great. Well, no questions have come in, so Rebecca, I'm going to turn it back over to you to close out with any housekeeping notes.
All right.
Thanks, everyone.
Thank you, Deb and Bob, for your time and your insightful presentation. At this time, MFA just wants to remind everyone to mark our calendars for 2017 events. Our first regional conference kicks off next week in Mississippi. Members can expand their education and networking skills for only $49 and bring a friend for $29. Our next live webinar will take place next Tuesday, February 21st. With Rebecca Johnson presenting powerful conversations to lead the shift from weight to well-being. Thank you again, everyone, for those who joined us today, and to our presenters, Bob and Deb, for their expertise and knowledge. I wish you all a great afternoon.